talking with public health, and we're finding out the state of the virus right now within Mahaska County and southeast Iowa. So kind of give us an update where we're at with the virus in Mahaska County.
Yeah, as far as virus activity in Iowa, Iowa's at 2% positivity rate. So that's really good. Here in Mahaska County, we're at 0.9, so 0.9%. So we've had 5 cases, I believe, in the month of June. So if we keep that rate up, we're doing good.
Let's walk through that difference from a year ago and what life was like then to now, and what the responsibilities are and what we're doing now.
Yeah, so I think a year ago it was new. It was a new virus. Not a lot of people have had it before, so we were seeing a lot of activity. Still learning how to prevent it with masking and social distancing and all of that. And then this year we also have in December started doing vaccinations. So we're getting those out here in the county, and that's definitely a positive.
Where are we at as far as vaccination rate here within Mahaska County?
Yeah, so we're at about 30% of people that are fully vaccinated. Another 2% have had the first vaccine, not the second vaccine. So our state is at 45% of fully vaccinated individuals, and then 50%, another 5% then, of people that haven't still to get their second dose. So whether they're, in that 21, 28-day period where they need to get the vaccine or they just haven't gone back to get it. I think that's where we're seeing some of the numbers for the, our 2%, there's people that haven't come back to get it or waiting.
As you're working with folks towards vaccination, what are some of those, I guess, roadblocks to help get more people vaccinated?
Yeah, in the beginning it was availability. That's not an issue anymore. So it's available if you want a vaccine. We need to, help you find a place you can call public health. We're not currently doing vaccination clinics because our pharmacies here in town are amazing, and they've partnered. Walmart, Hy-Vee, and Mahaska Drug all have vaccines. So if you want to get one there, or check with your provider here. There's opportunity to come in when you're seeing just having a regular appointment and getting that vaccine. I'm here on campus because we can make that happen too.
So the vaccine's available for all adults age 18 and above, is that correct?
Yeah, 18 and above with the Moderna and the Johnson & Johnson. Pfizer, which is at Hy-Vee, they can do 12 and above. So they have a little bit younger range that has been, approved. Mm-hmm. And Moderna, we're still waiting on that approval. So once that happens, we'll be able to do that 12 to 18 group that wasn't previously in that range.
And people that may have concerns about the vaccine, is there a place that they can go to get questions answered about should I or should I not vaccinate, those kinds of things?
Yeah, I would recommend the CDC website or the Iowa Department of Public Health. Those are two websites that have a lot of the accurate information. Sometimes if you just Google something, you're not going to get the right information, or check with your providers. They'd be happy to help answer any questions. They know your health and your wellness and what you need. So that would be another opportunity to check with those places.
And some folks just take the word of somebody they know a little bit more. You're a local person, your provider's a local person. If you're having concerns, do you think maybe it helps to speak with somebody that you know and trust then?
Yeah, I think definitely if you know and trust somebody, and your providers, hopefully someone that you know and trust, they were definitely going to want to do what's best for you. So those would be the places people should reach out to, not somebody that doesn't know or has information that we don't know how accurate it is. So just accurate information is those sites are the best to use.
What are we looking at for Iowans as far as hopefully finishing out vaccination or herd immunity? We hear that thrown around a lot. So kind of what is your crystal ball telling you about working with the virus and everyday life here?
Yeah, I don't own a crystal ball, so I don't really know how to answer that. But I mean, I'm hopeful with the vaccine. The more people, I'd like to see us closer to the state average, even above that, above the 50%. So, if you're just kind of thinking about it, waiting for it, it's available. So again, check with your pharmacies, your providers, call public health. We'll help you if you need, help arranging that. But getting the more people vaccinated, I think, is going to be helpful as we go into the winter months. And we don't really know how the virus is going to react. We're still it's new, so we're still learning a lot.
A person that's fully vaccinated, can they still transmit the virus to somebody that's not vaccinated? What what are kind of some of those caveats that go with that?
Yeah, you can, it's not 100% where you couldn't get the vaccine. You could transmit it and not know it. So that's why we still need to be careful. If we're around people that are high risk or haven't been vaccinated, you still want to be careful and use your social distancing, masking when needed and when appropriate. But yeah, you still want to be careful because we don't want to see anybody contracted that wouldn't do well with the disease.